Hey everyone, this is May 6th, and you are watching our community briefings that are held every Monday, Wednesday, and Friday at 3 p.m. This is going to be a long briefing. We have a lot of information to share, a lot of news to put out to the community as well as to the media. And so I'm going to ask everyone to be patient. We have a lot of data to share, and I think some good news about where we're going today. I want to thank Alice Castellanos from the Long Beach Health Department, who is going to be doing a Spanish translation summary at the end after the questions, like she does at every briefing. And we have Dr. Davis from the Long Beach Health Department, who leads, of course, our health team and our medical team, who will be also giving a lot of statistics and some numbers today as soon as I'm done with my remarks. And I also want to thank Paola, who, of course, is doing our ASL translation as she normally does. I want to begin by saying that this is, I know, has been a difficult few weeks. Our safer at home orders have been hard. It's been hard, I know, for a lot of people to stay indoors, to stay at home, to not enjoy our parks. To many workers, it's been devastating. To small business owners who want to be able to reopen their business, it has been a very difficult time, and we are very aware of that. We're also aware that we are living in an unprecedented health crisis. And this crisis requires us as a city to come together and to support, first and foremost, the most vulnerable people in our community. And in our case in Long Beach, that is our seniors and people with underlying health conditions. Today, I want to talk to you about two major areas. The first, which I'm going to talk to you, is I'm going to walk you through the data and what we've been doing to meet our expectations and our goals as it relates to this first stage that we are in of reopening. And then I'm going to talk to you about what stage 2 looks like, when we're moving into it, who is moving into stage 2, and what can we expect in that process. And so I want to begin today by talking about the governor's 4 stages of reopening. And let me begin by reminding everyone that the statewide health order that is in place, that cities and counties cannot go beyond those health orders. And so you might hear a lot of people say, well, I'd like to do this or we'd like to do that. We can only open as the state allows us to open. And so that is all a partnership that we're doing as a community. But within each stage, there is flexibility for cities and for counties. And so we know that there are 4 stages to economic recovery, and I want to review those. The first stage is safety and preparedness, which is the stage we are in today. The second stage is reopening lower risk workplaces, which I'm going to talk to you about in just a few minutes. The third stage is higher risk workplaces. And the fourth stage is ending the safer at home order, which is still a while away from where we are today. But those are the 4 stages. So as we know, we have been in stage number 1. And for us, stage 1 has been all about being prepared and being ready. And I want to walk you through what that's looked like in Long Beach and why we believe we have met this challenge and why our medical professionals believe that we have met the requirements of stage 1. First, we know that we are in a health crisis, and addressing COVID-19 remains our top priority. And so all of these decisions are guided by our health officials. Since we declared our initial health emergency on March the 4th, we have done an enormous amount, and I want to begin by talking about logistics and preparation. We have begun an enormous distribution and logistic process within the city. Since March 4th, we have distributed over 1.5 million PPE, 31,000 995 masks, 16,000 gowns, over 9,000 cloth and sewn masks, and we've made over 860 deliveries across the city as it relates to PPE. Now, this PPE, including the 1.5 million number, has gone to our first responders within our city. has gone to our healthcare facilities across the city and has gone to our long-term facilities across the community. These have been our nursing skilled centers, our senior homes, and of course our shelters. And we've also provided PPE to numerous nonprofits that have reached out and asked for our support. And this has been small clinics across the community. So your city, our community has been involved in ensuring that our city has the PPE necessary and that our hospitals have the PPE necessary to move through this first stage. We are also looking at additional data. And I want to show you this next graph. As of today, you can clearly see that Long Beach continues to track below LA County as it relates both to the rate of positive cases and fatalities. Now, it's important to note that every single death is a person and is a real family of who we pray for and mourn for. And you can see that as it relates to Long Beach and LA County, that we are trending below when you look at the 100,000 cases per population. And I mention that because, as you're going to hear in a minute, we are encouraged by the state to move as regions as we reopen our community. But counties and cities will be different. And the Long Beach Health Department, which runs our city, will have slightly some differences in the way we govern our city than LA County will. And you see that reflected also in some of the numbers. It's important to note that we've begun flattening this curve. And I want to show you this next graph that we have, which really shows what I believe is the most important number, one of the most important numbers that we see, and that is hospitalizations. When you look at hospitalizations in Long Beach, you can see that for the course of the last 25 days, that hospitalizations generally have remained flat. Now, what are the difference between these two bars? As you can see, that the lighter bar is the reported cases that we give you every day. When we watch these updates, there are reports on hospitalization. The blue or the darker blue graph is actually the more factual number once hospitals kind of catch up on their reporting. And so we report daily, but then every week or so, we get updates from the hospital that might give updates depending on how it's doing and the data that they have as to the exact hospitalization date. And so if you look at these numbers, you can see that we certainly had our largest spike early in April. But since that initial spike, the numbers have remained relatively flat. Why is this such an important graph? Because we know that the state and the governor are looking at a 14-day cycle of hospitalizations and trying to see how communities are doing. You can see by Long Beach's numbers that not only have we met 14 days, but we are almost close to 20 to 25 days of these numbers being generally flat. And I caution us, these numbers could change at any minute. And I want to talk about that in a minute. We're watching these on a daily basis. And now I want to turn another piece of data that we're looking at, which is really important as well. And these are our Long Beach COVID cases timelined by actual episode date. And if you can see this graphic, you can see that not only have we dramatically increased testing, where we're now doing over 1,000 tests a day, we've tested over 12,000 individuals across the city. But you can see also that timeline by episode, there is actually a slight decrease that is happening. And I want to put your attention on the yellow bar. You see a yellow kind of dotted line that is going through the numbers. That actually takes into account the 7-day average. And so when you look at the 7-day average, which is a better way of looking at this chart, which is how our medical team and our data folks look at, you can see that we are trending downwards as it relates to new cases and new episodes. And so this data I just showed you is all going in the right direction. I caution us that changes that we're going to discuss in a minute and the way data works, could it be different a week from now, 2 weeks from now, or tomorrow? Absolutely. We don't know. We can only look at what's happened up to this point and trends. And so just please know that data is movable and can change quickly, but the signs are good and pointing in the right direction. Now I want to talk to you about our hospital beds and our capacity. We've been talking about what is this crisis really about? And what this crisis has really been about from day one, in large part, has been ensuring that our hospitals have the capacity that they need for any surge in patients. We know people are going to get infected. We want to minimize that risk, and we want to flatten that curve because we want there to be enough hospital beds, ventilators, personnel, and PPE ready to take care of you and your family. That is the most important thing. And so let's look at how our hospital bed capacity is numbered and look at this graphic above. We have our area hospitals have a capacity of 1,500 beds daily. Of those 1,500 beds, the city has surged that capacity. We have 100 additional beds at the convention center. We have the ability, another 400 beds that we put all across the city as well. If you look at staffing, we're looking at many factors related to this capacity. Our bed usage right now in Long Beach is at 50% of normal capacity. That means that our hospitals have room and have the ability to bring in new folks that might get infected or that are battling COVID-19. Area hospitals have averaged 55 patients daily in April, as you can see. Sometimes it's been lower than that in the 40s. But it's been about that 50 range, between 50 and 55. And we have the capacity in our hospitals. We also have 225 ventilators available at our hospitals. The average use over the last month has been about 30% of that on any given day. And I mention all of that because it's so important that we understand that looking at this data and information is how our medical professionals are making decisions about what we can do next. And so that's been critical for me to walk you all through that information. Now, what are we doing next? We've just talked about stage 1. And on testing and preparedness, we are going through that. It doesn't mean that we've done a perfect job or we've gotten everything exactly right, but we are making good progress. Now I want to talk to you about stage 2. The governor, as you know, just earlier this week, allowed municipalities as early as this Friday to move into what he is calling stage 2. Stage 2 is lower risk activities. And in this stage, the city of Long Beach, because we have our own health department, can really guide our own future. You may be aware that earlier today, the County of Los Angeles, with its partnership in cities, have already begun releasing their plans into how they're going to reopen their economy. Generally, Long Beach has aligned with the county to ensure that we have a unified voice across all 88 cities in LA County. But there are also going to be some differences, which I'm going to talk to you about today, in how and what we reopen. But generally, we will be aligned with the County of Los Angeles. And that, by the way, is a recommendation from the state, is to try to do that regional alignment. So what are we going to do in Long Beach? I want to start by talking about this in 2 categories. One is going to be about retail and what we're doing this upcoming May the 8th, which is Friday. And then we will have some additional activities that will reopen on May the 11th, which is Monday. So let's first talk about May 8th and Friday. We are looking forward to partnering with the County of Los Angeles and the city on our May 8th reopenings. So what will be reopening on May 8th in Long Beach, or what we'll have the ability to? If you own a a florist, if you're a toy store, a bookstore, a clothing store, a music store, or a sporting goods store, all of those smaller retailers will be allowed to begin to open with curbside pickup only. The actual stores themselves will not be allowed to open inside for walk-in shopping, but there will be process set up so that folks can drive up and pick up things at the storefronts and at the stores. Now, it's important to note that the state is not allowing inside shopping at retail. So even if Long Beach wanted to open that, it's not allowed in the statewide order. But we are allowed to open florists, toy stores, bookstores, clothing stores, and sporting goods stores for curbside pickup only. So that will begin on May 8th. We will also allow car dealership showrooms to open up. Now, the car dealership showrooms and the small retailers will all need to follow strict physical distancing, face covering and mask rules, and infection control protocols that will be laid out by the Long Beach Health Department in the days ahead. And so you can be sure, if you are a small business owner and immediately have a lot of questions, we're going to be putting up a lot of information on the Long Beach COVID website over the course of the next couple of days, including checklists, resources, guides into how you can reopen safely. What else is going to be opening up on May the 8th? So now we've talked about retail. We're opening up that first phase of retail on May the 8th. On the issue of outdoor recreation, some outdoor recreation will be open on May the 8th, and the rest will open up on May the 11th, and I'll explain that in just a minute. In addition, on May the 8th, trails and our wonderful nature trails and walks that we have across the city, as well as public and or private golf courses, will also open on May the 8th, and that aligns with the Los Angeles County order as well, and the governor's guidance as it relates to outdoor recreation. And so trails, of which we have many, our wetland trails, our golf courses, those can begin transitioning to open on Friday. And then on Monday, and this is where there will be some differences with Los Angeles County. On May the 11th, we will also be doing some small additional openings. On Monday, May 11th, we will be opening up our parking lots adjacent to our parks so that families can come. You will be able to walk through all of our parks. There still will not be gathering at parks. You'll be able to walk through our parks. We are also opening up tennis centers across the city. So if you, to be done in a safe way, and we'll have details on how to do that. There's some types of activities within that won't be possible, but tennis centers will begin to open up. And we will be opening up the beach, bike, and walk path only in the city of Long Beach. And so our beach, gathering on the beach, swimming at the beach will not be allowed. But you will be able to cycle or walk along the beach path in the city. And so as it relates to parks and beaches, trails, walking, starting May the 11th. And why May the 11th? Because we're also going to, over the course of this weekend, our teams at Parks and Rec are going to be doing a major cleaning. We're going to disinfect a lot of our bathrooms. We're going to make sure that our parks and our beach spaces are clean and they're ready for the public come Monday. But I want to be also very clear. We will have strict enforcement, particularly on the beach, with lifeguards and firefighters and police, that if gathering begins to occur or other actions that are unsafe and are not being distanced, that enforcement will occur. We need people to follow the rules. We are providing relief, and we need your help in supporting that. And so those give you an idea of the differences between what's going to happen on May 8th, which is small retail, trails, and golf, and May 11th, which is the beach bike path and walking trail, the tennis centers, and the parking lots at our parks. That being said, I want to just remind us also that there's a lot of other things that can't open. So we still cannot have restaurants with dining facilities. Offices are still not open. Many of our cultural centers and museums are still not open. Other businesses are not open, and all of those have not been given the green light by the state to reopen yet. And so as soon as there's guidance, then we'll have more information on those in the weeks ahead. I want to, before I turn this over to Dr. Davis, I just want to say that Long Beach has its own health department. The county has its own health department. These decisions were made not just in coordination with the health department, but also understanding that we are our own large community and city. Long Beach is roughly the same size as Atlanta, Georgia. We control our own health destiny within our community. And so I want people to understand and know that while we will align with the county when possible, there will oftentimes be some differences that relate back to the difference in data that you are seeing in Long Beach versus the rest of the county. And as a reminder, that once the things begin to open this Friday and Monday, over the course of the next 2 weeks after those openings and the weeks ahead, we will be monitoring all of that data I showed you earlier at hospitalizations, positive cases, deaths as they relate to other places across the state and country, because if there are spikes or if we need to make adjustments, we will do so. And at the end of the day, the most important thing is the health of our community. Please remember that we had positive cases and deaths and hospitalizations before these reopenings. And we will have hospitalizations and unfortunately deaths and other types of measures that we track during this reopening. It really is about how we can best prepare and ensure that our medical professionals have what they need and that we're not seeing any spikes. And so we ask for your support. Wear a face covering, please, when you go into any of these stores, when you're outside, unless you're walking through your neighborhood. Physical distance when you're at our trails or walking through our parks. Be responsible over the next few days. And if folks can stay home, if you are a vulnerable population, if you are a senior, please continue to stay home. Don't put yourself at risk. Let's do this together. And I look forward to next week sharing our progress and how we're doing. So thank you. I know that was a lot of information, but we'll continue to put more information out in the days ahead. So if you have questions, your answers are coming. And with that, I want to turn this over to Dr. Davis, who's going to give us more of an update. Thank you, Dr. Davis.
Thank you, Mayor Garcia. Good afternoon, everyone. Today I'll start with a brief update on our numbers. We now have 791 Long Beach residents who have tested positive for COVID-19. I'm sad to report that we've lost one Long Beach resident to the virus since our last briefing on Monday. The patient was a man in his 70s with underlying health conditions, and our thoughts and prayers go out to his family and loved ones.
I'd like to acknowledge National Nurses Week. Today, May 6th, launches National Nurses Week to recognize and celebrate the contributions that nurses make across our country. We appreciate all of the nurses who are on the front lines of care during this COVID-19 pandemic. Nurses courageously step forward amidst fear, uncertainty, and overwhelming challenges. Nurses sacrifice time away from their families and risk their own well-being to care for others. They comfort terrified and apprehensive patients and grieve with those who have lost loved ones. Within the city of Long Beach, nurses have been leaders in our COVID response. They've run our testing program, both at our drive-thrus. They've collected test samples at our drive-thrus, but also at people's homes and in our long-term care facilities. They staff our shelter and isolation sites. They treat people at our rapid assessment clinic. lead outbreak investigations in our long-term care facilities, and conduct contact investigations. When not responding to COVID-19, nurses play a vital role at the health department. They provide immunizations, treat TB, STD, and HIV positive patients, provide family planning, conduct home visits, support people experiencing homelessness and older adults, and much more. We are so grateful for all of the nurses serving the city of Long Beach. Thank you for your commitment, compassion, and extraordinary skill. We could not function at the health department without our nurses. So I want to end by mentioning our contact tracing. To more fully open the city, we need robust contact tracing. Along with robust testing, which we have, contact tracing is a very effective tool for limiting community spread. The Long Beach Health Department already does contact tracing. This is where we ask people who are positive for COVID-19 who they've been around, and then we ensure that those people quarantine for 14 days to then stop the spread of COVID-19 from that person. So we're doing that now, and as our testing capacity goes up, we'll be staffing up so we can meet the increased need. The state has partnered with UCSF and UCLA in a virtual contact tracing training program. The City of Long Beach will be piloting the training program for the state and will be able to provide valuable feedback into the process. I just want to end by re-emphasizing what the mayor mentioned. As we relax our restrictions, the Safer at Home order, and more of us are moving about, it's going to be even more important that we follow those practices in order to limit the spread of the virus. It'll be even more important as we're able to get out more, that we're washing our hands on a regular basis, that we're covering our faces, that we're really keeping that 6 feet distance, that we're using hand sanitizer, and that if we are sick, that we don't venture out, that we stay at home. Thank you.
Thank you, Dr. Davis, and I'll turn it over to Jake, who will have some questions.
Thank you, Mayor Garcia. Thank you, Dr. Davis. The first question we have coming from our media is from Rachel from Channel 7. Go ahead, Rachel.
Thanks. Hey, so as we're heading into stage 2, I'm wondering, how will the city be monitoring or enforcing that businesses are complying with the different stages of reopening? Because I think there are a lot of businesses out there that kind of fall into this gray area. And the state has had a lot of very specific guidelines, like sporting goods stores or clothing stores. And I think there are a lot of small businesses in Long Beach that I can think of that are kind of in this gray area. So is the city doing any small business outreach during this transition?
Yes, so a couple things. So one I would say is, essentially, if you are a small retailer, a florist, toy store, bookstore, clothing store, boutique, music store, sporting good, you can open up with curbside pickup only. That is the rule set by the state, and now it will be set by the city. We're going to be hosting, we're doing one later today, and over the next few days, all the business associations across the city, if you belong to a business improvement district, all of those partnerships will be having briefings and conference calls, and we'll be bringing together industries over the next few days to answer questions. So please be on the lookout for that. And also our economic development site at the longbeach.gov webpage will have a lot of information for these businesses. But if you're not one of these businesses that's retail specific and hasn't been called out, you're likely not allowed to open unless you are listed in the health order. And the health order itself will be up, I believe, in the next day or so. And so that is coming. And we know there's going to be some confusion. It's not going to be perfect. There will be some gray areas, but we hope to walk people through that and to answer everyone's question as we move forward. It's really important for folks that can't reopen to understand and know that is who is not allowed to reopen as well, which is why I mentioned some of those.
All right, moving forward, we will have the next question from Kelly Puente from The Post. Go ahead, Kelly.
Yes, with hospitalization rates remaining flat or slightly decreasing and death rates remaining lower than that of the county, can you talk a little bit more about what indicators you're looking at for moving into phase 3 and just a little bit more on that timeline and what that would look like?
Sure, I can give some response to that, Dr. Davis, if you have any other medical thoughts on it. So I think first it's important for people to remember that the city doesn't decide when we move into stage 3. So that is not up to us. The state first has to allow stage 3 to begin for then the city to contemplate going into stage 3. And so within stage 2, it's currently being phased in. And so for example, we talked about dining inside restaurants. That is listed in the state as part of phase 2, but it's not in this first group of retail and businesses that the governor is allowing to reopen. And so we will move as quickly as first and foremost is allowed by the state and the guidance, and second is supported by our own internal data and our own internal numbers that you referred to. And so there is no going into stage 3 unless the governor opens it up to cities. I will make a quick note. The state is allowing cities and counties to apply essentially for an expedited stage 3. However, that is really a program that is set up for rural counties and rural communities, of which measures to meet essentially are for counties that have had no deaths or very few. And one of the key measures of moving through stage 2 quicker, for example, is having no fatalities over 14 days. And so that's not something that we should expect that cities or counties like Long Beach, LA, Orange County, the Bay Area will be able to meet. And so I think as soon as the governor gives, let's put it this way, we have to get through stage 2 before we can even think about stage 3. And we're not even through all of stage 2. We're at the first part of stage 2, and we've got to make sure that this first part is safe. Hospitalizations don't go up. People are following the rules. There's not a burden in our hospitals. And if we see that at that point we're okay, statewide, the governor will make some decisions about what we can do next. And then the city will make our own decisions about our own timing. So if that explains the process.
Thank you, Mayor. The next question is from Haley from the Press Telegram. Go ahead, Haley.
Hi, yeah, my question is about the recreation areas. I know some cities in Orange County, including Seal Beach, are looking at reopening their beaches for water activities, including swimming. So is that something that Long Beach is looking at? And if so, when might that type of thing fall into the reopening process?
I mean, we're looking obviously at everything. We look at everything all the time, but we're at this moment, Long Beach is not reopening the full beach to swimming and other types of activities. We are still limiting gatherings at the beach, not allowing gatherings at the beach or at parks. And part of that is because even though our indicators are moving in the right direction, we do know that the density of cases in Orange County and those other communities is less than Long Beach and LA County. And so they have different needs and desires. What's happening down south is they're looking at their own indicators and we're looking at ours. And so we would love to get to a point where we can fully reopen the beach and fully reopen our parks, but Long Beach is just not there yet. And our medical team doesn't believe that it's safe to do so at this time. Dr. Davis?
Mm-hmm. Yeah. And we will be monitoring the staged opening like the mayor mentioned. So as we kind of get through the next few days or so and kind of see how that pans out, then we've been making further decisions.
Thank you very much, Dr. Davis. Now that we are going to transition over to some of our questions from our Facebook followers here on Facebook Live, and Dr. Davis, while we have you there, can you give us a little bit of background about contact tracing? And really, as it relates to COVID-19, how are we supposed to do contact tracing if you're only supposed to get tested if you show symptoms? Can you give us a conversation relating to asymptomatic testing, if that's in the future? What does that potentially look like as it relates to contact tracing? Because that's certainly a part of this phased approach.
Right. So thank you for that question. So basically, contact tracing is whenever we find a case. So whether you only test people who are symptomatic or you test people who are asymptomatic, as soon as we have a positive case, then that's when the contact tracing would start. So as we expand our testing and really aggressively test those who are symptomatic, even mildly symptomatic, we will catch more people. And if we expand beyond that, then yes, we may catch more people on top of that. Once we have that positive case, though, then basically what contact tracing is that you kind of talk to the person about all the different places that they've been while they were in their contagious period. And then you would contact all those people. And so it could be that they went to an event. And so you may have to write a letter saying, if you were at this event during this time, you may be at risk for COVID-19, and this is what you should do about it. Or it could be that there's specific people that you would contact and say, you know, you've been exposed to somebody. And basically what exposed means is you've been around somebody who's infected, who could have infected you. And so then we tell you what to do, which is basically to quarantine for 14 days. So that's kind of the overall what contact tracing is. There's a lot that's involved. It's kind of this whole step-long process from the moment that you get that positive test and then do the interview of the positive person and then have that person identify all the people that they've been in contact with and then contact all those people and then monitor both the person, the original person who was sick, and then all of their contacts, you know, calling them on a regular basis and what have you, and, you know, making sure that they're okay and if they need anything. Each case is predicted or estimated to have about 10 contacts. So you can see where that would be this very large, labor-intensive process.
Dr. Davis, while we have you there, thank you for that answer. I think on Monday, we talked about mental health and we talked about the concerns and things that are fears that people have. And certainly this process of reopening generates a lot of fear for people. There's a lot of excitement, but also a lot of concern and trepidation. That said, if we do see a spike or we do see things start to change, can you elaborate in the plan or if we do need to transition quickly, what does that look like and how will we make those assessments for our viewers?
So I feel that right now the important thing is for all of us to assess our own risk. So you know yourself, you know who you live with, you know what your health status is, and you also know what your mental health is and what you what's really important to you. And so I think as things get relaxed, each of us is going to have to make decisions on a regular basis about what it is we want to do and what risk we're willing to take. We're not, for the foreseeable future, ever going to get to a zero risk of COVID-19. And so it's basically you assessing your risk and making your best decisions with all the reputable information that's out there about whether you feel like it's necessary to do whatever the thing is that you're wanting to leave the house to do, whether it's work or recreation or what have you. And then also trying to do it in as safe a way as possible. I love the library, so that's what I really, really, really miss. I cannot wait until it opens again. Am I gonna go and browse as soon as it opens? Maybe not. I might order everything online and then just go pick it up. So I think that that's what everybody is going to have to do, is kind of make that decision. Like for me, I want the library, but I'm gonna adapt how I interact with the library. So that's what I would recommend for everyone.
Thank you, Dr. Davis. And before we switch over to the mayor, there is a couple of questions, obviously related to health. Pertaining to the heat wave. We have a lot of heat coming up and expected forecasted for the next few days. What's the plan to address the heat? What's the plan? What are we encouraging families to do to try to stay cool? And does the city have a plan for cooling centers?
So we do have a plan for the city of Long Beach. So we monitor what's called a heat index, which takes into account both the actual temperature and our humidity. So we're always monitoring that. And then when we rise above a certain level, then it will trigger an advisory or the activation of cooling centers. So As soon as that happens, we will definitely be putting out information about cooling centers and how to do that safely with physical distancing, and all of the other types of facial coverings and what have you. And in the meantime, I think it's really important to drink a lot of water, to stay out of the sun, like the direct sun. If you are out there, of course, wear sunscreen. If you have underlying medical conditions like respiratory conditions, then you probably don't want to be doing a lot of strenuous exercise out in the heat.
Thank you, Dr. Davis. Now moving over to the mayor, a couple of questions that we have here for you. Sure. And this relative to some of the conversation we're having to the phased opening and reopening of some of our businesses. And there's a lot of questions about guidance for churches. Can you talk a little bit about what churches look like, and then we'll get into some of these other questions relating to some of these other specifics.
Right, and so I think that obviously for a lot of individuals, particularly people of faith, I consider myself one of those, and my family certainly is. It is frustrating and hard not to be able to reconnect through our places of worship. It's also churches, places of worship are not yet places that are being allowed because of gathering and physical distancing per the statewide order. Obviously, that is something that we look to in the future, but it's just not something that is part of this initial stage. As soon as we are there, we will move as quickly as we can, as long as health conditions apply, but it's just not where it's at right now.
Great, thank you, Mayor. Some of the other questions that we're seeing here really are relative to the parks and the playgrounds for the kids and the skateboard parks. We've talked about that. We've talked a little bit about the idea for our parks as it relates to summer camp program. There's a concern about what are we doing for the summer camp. So we have a great parks program in the summer. What's the plan for that? And obviously registration potentially is coming up very soon. Do we foresee that that's still happening?
Yeah, we don't know yet. First, I think it's important to note that the playgrounds are still closed. You cannot play team sports, in playgrounds. You can walk through parks. You can use the hiking trails, but those are just not activities. All those activities require a closeness that is difficult to manage, obviously, and to be safe. And so we don't know where that's at yet, but we don't expect that a lot of those activities are going to restart anytime over the course of the next couple of weeks. And so people just need to be patient. As things are allowed, there will be guidance. Every outdoor activity that we have mentioned today is listed as an outdoor activity that is allowed by the state and that there's guidance on. Other types of activities that we would love to enjoy and that kids especially want to play, like baseball or basketball or soccer, those are not recommended at this time by the state guidelines or any of the local jurisdiction guidelines. And so we're just not sure yet where that's going to end up. And as soon as we know, we'll let folks know.
Thank you, Mayor. In the presence of time, we want to make sure that we can tell everyone, there's a lot of questions coming out specifically related to the individual things, whether it's pet grooming, whether it's different types of events or local businesses. Please make sure you are following us at www.longbeach.gov/COVID-19 for additional information. That's where a lot of this stuff you'll be able to find after the press conference that will be able to provide you additional guidance and direction. Mayor, thank you.
I think that's absolutely right. And so just make sure that all that information, once the order comes out, that will be before this Friday date, that health order will list exactly in detail each type of industry and the rules. And so we'll look forward to that. And I'll have more to report on Friday, obviously. Let me go ahead and turn this over to Alice Castellanos from the Health Department, who will give us a summary in Spanish. Thank you.
Muchas gracias, alcalde, y gracias, doctora Davis. Muy buenas tardes. Gracias por estar con nosotros esta tarde, 6 de mayo. Primeramente queremos empezar que estamos muy orgullosos de todos que vivimos en la ciudad de Long Beach por seguir las órdenes de más seguro en el hogar, pero también queremos dar un poquito de los datos. Hay muchos datos esta tarde, pero voy a tratar la mejor manera de hacer un resumen. El gobernador del estado de California, recuerden que desde el lunes les avisamos que hay 4 etapas. Hoy todavía seguimos en la primera etapa, es donde nos enfocamos más en la seguridad y preparación. La etapa 2, que es la etapa donde queremos seguir en estos próximos días, más temprano que el viernes 8 de mayo, que los lugares de trabajo de menor riesgo y negocios pequeños se van a reabrir. Y voy a hablar un poquito de cuáles negocios son esos que se van a reabrir. La etapa número 3 son lugares de trabajo de mayor riesgo y la final etapa, que es la etapa número 4, es el fin de la orden y el fin de quedarse en casa. Eso es cuando los grandes eventos puedan reanudarse, como conciertos, festivales y esas cosas. Y realmente estamos buscando últimamente una vacuna y tratamiento efectivo para poder terminar y concluir con la etapa número 4. Pero le queremos decir también que el gobernador ha anunciado que desde tan temprano como este viernes 8 de mayo reabrir los negocios pequeños como las florerías, tiendas de libros, tiendas de música, de juguetes, pero solamente con ventas de recoger a la curva o afuera en la calle, por decir. Todavía no estamos listos para que la gente entre a estos negocios y hacer sus compras físicamente adentro de la tienda, pero sí pueden ordenar cosas, productos, materiales y recogerlos afuera. También no estamos listos para reabrir como restaurantes y cosas así porque es muy riesgoso. Lo último que queremos ver es reabrir ciertos negocios y luego tener que regresar a cerrar las cosas de nuevo. Queremos también, sé que hace unos momentos cuando hablaba el alcalde, vieron unas imágenes de algunos números y algunos datos y nomás voy a hacer un resumen corto sobre esos datos que vimos en la pantalla. Desde el 4 de marzo, que fue cuando empezamos esta epidemia, hemos podido proveer protección, equipo de protección a varias organizaciones, especialmente a los hospitales, los centros de enfermería de largo plazo, más de 30 millones máscaras del N95, más de 16,000 vestidos de protección para el personal médico y también hemos dado mucho equipo de protección a los centros médicos de la comunidad. También les queremos recordar que es muy importante seguir protegiéndose, sea la manera en que vayamos avanzando en esta etapa número 2. Sabemos que es muy frustrante, sabemos que viene el calor, sabemos que algunas otras ciudades y condados están abriendo los parques y las playas, pero nosotros todavía no estamos preparándonos para eso. Lo que sí podemos decirles que pueden abrir este fin de semana es los paseos donde se camina sobre la playa, pero no la playa en fin como para nadar. También puede todavía asistir, ir a un parque y caminar en las áreas donde se puede caminar o en los paseos de naturaleza y cosas así, pero recordarles que no pueden ir los niños a jugar en los juegos en los sitios de los parques todavía. Ha visto muchas preguntas sobre los programas de actividades de deportes, pero eso todavía eso significa que serían los grupos más grandes. Personas todavía no estamos preparados para que se junten en grupos muy grandes, sea en tiendas, en restaurantes o en actividades deportivas. También en las gráficas vimos lo importante que fue que nuestra meta desde el primer día fue que no tuviéramos problemas del número de camas que están disponibles en los hospitales y eso nos orgullece en compartir que estamos muy bien en ese departamento. Hay más que suficiente personal médico, más que suficiente camas disponibles por si se enferman las personas y es por eso que podemos entrar a la etapa número 2. También queremos decir que tenemos más de 255 ventiladores y solo alrededor de 30% están en uso, por lo que también tenemos capacidad ahí. En los próximos días vamos a publicar más información sobre nuestro pedido más seguro en casa. Estamos preparados, estamos coordinando y volveremos a abrir según los datos y la ciencia. No nos vamos a apresurar y solo quiero decir nuevamente que tan orgulloso que estamos de la gente de Long Beach para poder hacer este procedimiento lo más seguro posible. Muchas áreas del país han sufrido mucho peor que nuestra situación en la ciudad y de eso estamos orgullosos y queremos seguir en esos pasos. Debido a la experiencia de nuestro Departamento de Salud, nuestra coordinación del condado y el estado, queremos recordar que vamos a seguir todas las órdenes del condado, pero como nosotros en la ciudad de Long Beach tenemos nuestro propio Departamento de Salud, sí podemos también coordinar y hacer nuestras propias pólizas sobre la reapertura de nuestra ciudad. También queremos platicar un poquito sobre el rastreo de contacto. Para abrir completamente la ciudad necesitamos seguir unos seguimiento de contactos robusto. Entre más pruebas y sitios de pruebas tengamos en la ciudad, obviamente vamos a ver que los números de pruebas positivas van a subir también. Eso significa que cada vez que tenemos un resultado positivo, nuestros equipo de epidemiología llaman a las personas, hacen una investigación para hacerles preguntas como, por ejemplo, en dónde trabajan, en qué sitios estuvieron públicamente para poder rastrear otros posiblemente contactos que también posiblemente pueden salir positivos. Junto con las pruebas sólidas que tenemos, el rastreo de contactos es una herramienta realmente efectiva para limitar la propagación en la comunidad. El Departamento de Salud de Long Beach ya realiza el seguimiento de contactos y a medida que aumenta nuestra capacidad de prueba, estamos dotando del personal que podamos satisfacer la necesidad. Obviamente, entre más sube el número de casos positivos, más personal vamos a necesitar para que hagan llamadas y empiecen las investigaciones. El Estado también está en proceso de desarrollar una aplicación para que pueda ayudarnos a rastrear estos datos. Tendremos más información en los próximos días también. En algunas noticias más livianas, y queremos compartir que esta semana estamos celebrando el reconocimiento de las enfermeras. Hoy, el 6 de mayo, se celebra la Semana Nacional de Enfermería para reconocer las contribuciones que hacen los profesionales de enfermería en todo el país. Agradecemos a todas las enfermeras que están en las primeras líneas de atención durante esta pandemia del coronavirus. Las enfermeras sacrifican el tiempo lejos de sus familias, se arriesgan su propio bienestar para cuidar a los demás, consuelan a los pacientes y a las familias que desafortunadamente han perdido a familiares por este virus. En la ciudad de Long Beach, las enfermeras responden al coronavirus, colectando muestras de pruebas, dotando de personal y refugios y sitios de aislamiento y realizando investigaciones de contacto como parte del programa de control de enfermedades transmisibles. También un saludo y un agradecimiento especial para todas las enfermeras de la Unidad Reserva Médica de Long Beach que se ha estado sirviendo en la comunidad como voluntarios y tratan a pacientes que están enfermos en la clínica de evaluación rápida, que ahorita todavía está abierta en el Colegio de Long Beach sobre la PCH. Estamos muy agradecidos por todas las enfermeras que sirven a la ciudad de Long Beach y gracias por todos sus compromisos, su compasión y habilidad extraordinaria. Eso es todo por hoy, pero recuerden, pueden recibir más información y datos importantes después de esta conferencia de prensa en el sitio de web de la ciudad de Long Beach del coronavirus. Gracias.
Muchas gracias. También quiero decir que este jueves, este jueves a las 1:30, vamos a tener una town hall en español para la comunidad que habla español. Es jueves a las 1:30 y la información está en las páginas de la ciudad, de Facebook y el número, todo. Por favor, si aquí tienes cosas que quieres decir o preguntar, este jueves a las 1:30 en español, un town hall para COVID-19 para la comunidad latina. Muchas gracias. And again, thanks for watching. I know there's a lot to report. We will have probably a lot more on Friday just to get everybody ready for the weekend. So thanks again.